kindly let us know what exactly is pituitary adenoma.
One of the common brain tumor. It constitutes almost 10% of all primary brain tumors.
What exactly are the causes of pituitary adenoma?
Most of the time it's sporadic, like causes not known, but sometimes, rarely, it can be associated with few syndromes.
Is it genetic in any way?
Few cases it can be part of syndrome, it can be genetic, but most of the time it's not genetic.
Are there any cases where people have gone completely blind because of this?
Yeah, that's there because if tumor is more than 1 centimeter, so initially as we discussed there will be field effect like difficulty in seeing on the side, but as tumor grows.
So do these tumors grow back?
Yeah, chances of recurrence are there, but there are variety of ways.
How long does these operations take?
1.5 to 2 hours, really, 1.5 to 2 hours.
So what kind of tests are mostly recommended to these patients?
Mostly to rule out, we do blood investigation as we discussed for hormonal evaluation.
Hello everyone, welcome to 2050 Healthcare. Today we have with us Dr Anil Sharma, who is a leading neurosurgeon working with AIIMS Raipur. Namaskar sir.
Namaskar.
Sir, today we will be speaking about pituitary adenomas. Sir, kindly let us know what exactly is pituitary adenomas.
The pituitary adenoma, that's one of the common brain tumor. It constitutes almost 10% of all primary brain tumors, and this tumor arises from the pituitary gland. Pituitary gland, like how we can understand, pituitary gland is called master gland of the body, like orchestra of the master of the orchestra of the body, and it's situated right at the base of the skull, right at the geographic center of the brain, just behind the nose and eyes, and it's few millimeter, but it control almost all the hormones of the body.
Okay.
So that's why it's important. So this pituitary tumor can be two types primarily. It can be functional or it can be non-functional. That we'll discuss later.
Like mostly, as you mentioned, it is master gland, right? Sir, we would request you to kindly explain a bit about the gland and what are its functions.
Yeah, it regulates all kind of hormones in the body, all kind of hormone. Primarily, this gland is only responsible for that. So we can understand with one fact, like if there is few millimeter size tumor, functioning tumor is there in pituitary gland, so that will alter entire personality of the patient, depending on what kind of hormone it's producing, over secreting. It can alter the entire personality.
What exactly are the causes of pituitary adenoma?
No, most of the time it's sporadic, like causes not known, but sometimes, rarely, it can be associated with few syndromes like multiple endocrine neoplasia or neurofibromatosis. But most of the time causes not known and it's sporadic.
Is it genetic in any way?
Yeah, in few cases it can be with part of syndrome, it can be genetic, but most of the time it's not genetic, most of the time.
Sir, what exactly are the early warning symptoms or signs of this disease?
That depends on what kind of tumor it is. Like broadly we classify into two types. One is functional and one is non-functional. So non-functioning tumor, what does it mean? Like that tumor itself is not producing any not producing or over secreting any hormone. So this how does this tumor create problem then? Because it create problem due to the mass effect over the mass effect or compression over the adjacent brain structure, like pituitary, like optic nerve, optic chiasm. So it create compression and patient present with vision loss, maybe headache, and vision loss is quite characteristic in this kind of patient. Patient often complain like they are having difficulty in seeing on the either side. So they complain like they are feeling like curtains are closing because they cannot see on the sideways.
Okay.
And this might often lead to like bumping into the object, that can create problem. And another thing, that functioning tumor, that symptom depend on what kind of hormone it's producing. It can be growth hormone that lead to acromegaly. Acromegaly, like there will be coarsening of facial features, there will be enlargement of hands, enlargement of feet, and it affects the entire skeletal system also, heart also. It can lead to enlargement of heart muscle, cardiac muscles, that is called cardiomyopathy, and that is the one of the most common cause of mortality in these kind of patients. And it can lead to change in bone, change in bone health. It can lead to spinal stenosis that can cause problem. I remember one patient, like the patient came with uncontrolled diabetes mellitus, very high sugar level. His sugar was not controlled even on higher dose of insulin, and he had visited multiple hospitals in the entire country, almost I remember almost 7-8 hospitals.
Okay.
So he came to us. Then he, of course, along with uncontrolled diabetes mellitus, he had coarsening of facial features also. And then we did diagnosis and we operated, and after surgery, then now he's completely free of any medications for diabetes mellitus. So that is one thing. And another problem with growth hormone, like they keep complaining about like their size of their clothes and number of shoes, that's frequently changing, because it's over a period of years. So it take many years to diagnose these kind of disease. So one is growth hormone, another is prolactinoma. Prolactinoma is very common. In prolactinoma, like there is secretion of prolactin hormone. It create problem in menstrual irregularities and period problem in women, and fertility issues in men. And another is ACTH secreting pituitary adenoma, that cause problem like high blood pressure, high blood sugar. That hormone will be deranged, and they will get that buffalo hump, what we call buffalo hump. There will be deposition of fat over face and other part. So moon-like faces, mask-like faces, expression-less faces, and these are the common presentations of these kind of tumors. So it entirely depends on functioning and non-functioning tumor. Non-functioning tumor primarily cause trouble due to their compression over the adjacent structures, that is either vision or headache, hydrocephalus, depend on what kind of structures, how big the tumor is. But functioning tumor, they need not be big. A small tumor also can produce symptom. Few millimeter tumor also can produce symptom.
Sir, as you mentioned that these kind of tumors, they compress the optic nerve. So are there any cases where people have gone completely blind because of this?
Yeah, that's there because if tumor is more than 1 centimeter, so that cause compression over the optic chiasm and optic nerve. So initially, as we discussed, there will be field effect like difficulty in seeing on the side, but as tumor grows, so that cause severe compression over the optic apparatus, and that people can go blind after that. I've seen many patients. It's not very uncommon, and primarily in our kind of setup, like we get patients from with long history of vision loss. We get patients from very remote areas. So it's not very uncommon to see this kind of patient.
So these kind of tumors are common, you're saying, right?
Yeah, these kind of tumors are common.
Okay. Sir, as you mentioned that the signs and symptoms take a long time to produce themselves.
Yes.
So whenever a patient reaches you, how do you do the diagnosis?
Yeah, it takes very long time, and these are almost all these kind of tumors are non-cancerous. They are benign tumor, and it takes they grow very slowly. It takes very long time. And first, like when patient present with these kind of symptoms, so we do MRI scan. MRI scan, we identify like there is tumor. Then we do all sort of hormonal test.
Okay.
Like we need to identify which kind of hormone this tumor is producing. So we do that hormonal test and eye checking, like how much is vision loss and field loss. So all those testing we need to do.
So mostly these kind of tumors are benign or cancerous?
No, mostly these tumors are benign. These are non-cancerous tumor. Very small fraction of these kind of tumor can be malignant, but that's very uncommon.
Okay.
Most of these tumors are non-cancerous and fairly treatable.
So, but still, whenever a common man hears that he or she has a brain tumor, then people connect it immediately to cancer, right? So that certainly would be creating a kind of trauma on that patient as well.
Yeah, that's
so how you people manage that?
Yeah, that's true, but we need to clear that like these tumors are benign, and this tumor has been there for many years and it's fairly treatable. and like after surgery they can lead a normal life.
Okay.
Whether it's functional or non-functional tumor, there are variety of ways to tackle that, and then they can lead a absolutely normal life after surgery. So there is no need to worry about all these things.
So, like any kind of psychiatric intervention is not required for these kind of patients, right?
No, not.
Like, okay. So, one more thing actually I wanted to know, like as you mentioned, the symptoms of functioning and non-functioning tumors are completely different. Whenever a person reaches you with either of the symptoms rather, apart from the diagnosis and these tests, so what is the next line of procedure which is undertaken by the neurosurgeons?
Yeah, we do investigations after that. Once patient come to us with these symptoms, we take detailed history, and after detailed history we need investigations, MRI brain and hormonal evaluation. We need to see what kind of hormone this tumor is producing, and then we need to do detailed ophthalmological evaluation to see the vision loss. And depending on all these findings, well, most of these tumors require surgery, particularly when symptomatic. Functional tumor except prolactinoma, all functional tumor require surgery, and non-functioning tumor, if that is causing vision loss, that also requires surgery. Vision loss or any symptomatic brain pituitary adenoma, that also requires surgery.
So, can we deduce like 80% of the cases require surgical intervention?
Yeah, no, surgery is required in all except prolactinoma, because prolactinoma we have medical management for that.
Okay.
And a fair number of prolactinoma that can be treated with medical management. That is the only tumor we do primary medical management for that, only pituitary tumor. So we start on medications, and over a period of time these tumors shrink in size, and their hormonal value that also comes to normal, but need long follow. And if tumor is resistant to medical management, like despite taking medical management, tumor is growing or patient is developing symptoms like vision loss or hemorrhage, and in those kind of prolactinoma cases we need to do surgery. Most of these cases can be managed medically.
So, do these tumors grow back?
Yeah, chances of recurrence are there, but there are variety of ways, because in a non-functioning tumor, if some part is there, that can be followed. And if tumor regrows, then we can give adjuvant therapy, radiotherapy that can be given. But in functioning tumor, we need to be very careful, because even if a small whit is left behind, that again can continue their secretion, and patient again can remain symptomatic for that. So we need to, like if we can remove completely, that's very good. That's actually required. But sometimes what happens, like when tumor is very adjacent to internal carotid artery or vessels, so it becomes cavernous sinus, it becomes very difficult to remove that part of tumor. So that part can be managed with adjuvant therapy, gamma knife and radiotherapy. But most of the time it's possible to remove entirely the tumor.
Sir, is there any specific age bracket or a gender which is more vulnerable to this?
Yeah, most of the time it happens in adult patient, and it's more common, slightly it's more common that in female. In women it's slightly more common, that cause is not known. What is the reason that we do not know?
Sir, we have heard that these surgeries normally you people do it through the nasal pathway. Is it true?
Yeah, it's true.
So kindly explain.
Yeah, most of the time, almost like a very less number of patients need to be treated by transcranial route nowadays. Almost all the patients can be managed with the endoscopic route. So it's completely scar free. There is no incision. We use high definition endoscope, and we put endoscope through nose. Then we go the bone behind the nose, that is sphenoid sinus and sella, and then we create a small bony opening, very small bony opening, and then we reach the tumor. So there is no incision in that, and we most of the time immediately after surgery they report significant improvement in vision. If we are operating for the non-functioning tumor, immediately after surgery they report significant improvement. Like they see, like I can see that hole is bright, and this thing I can see on the side of my face, on either side I can see. But if that compression or vision loss is very long standing, like it had been there since many years, then it become difficult, and it may take a couple of months for recovery. It may take a couple of months for recovery there.
So normally, how long does these operations take?
1.5 to 2 hours, nearly 1.5 to 2 hours.
Whenever a patient undergoes these kind of surgeries, like post surgery, like can they immediately breathe through the nose, or is there any kind of difficulty for that?
Yeah, because what happened, like when we operate through nose, so we put for compression for a couple of days. That practice varies. I usually keep for 2 days. So we put a pack in the nose.
Okay.
So immediately after surgery, they need to breathe through mouth. But after 2 days, that pack can be removed, and then couple of days they are free to go home.
So, but most of the cases, as you mentioned, since with the advancement of science, these surgeries are fairly successful.
Yeah, these surgeries are fairly successful. This is one of the most common brain tumor, and these are treatment is fairly treatable, this kind of disease. And they report significant improvement in their symptoms, significant improvement in vision. Like if we operate for functional tumor, there will be that menstrual irregularities will be corrected,
Okay.
that diabetes mellitus, that will be corrected, that other problem like heart problem, musculoskeletal problem, that will be reversed depending on what kind of hormone they are producing.
Okay.
So this is one of the most gratifying surgery actually for the surgeon and patient both.
So, post surgery, how long normally these patients are put on medication?
So usually for couple of days after surgery, we need to observe for any electrolyte imbalance or for water problem like diabetes insipidus. But if that is not there, then after a couple of days the patient can be discharged. But sometimes in functioning tumor, because there are irregularities in the pituitary function also. So sometimes they need to be put on prolonged medication, hormone replacement medications. That depend on again on that what kind of deficit is there.
Sir, we have heard a phrase called wait and watch in terms of pituitary adenomas. Kindly help us with that.
Yeah, that is because as we have seen in recent time, like more number of diagnostic facilities have really improved in our country. So what I mean to say, like more number of patients are getting investigated. Like somebody is there for headache and like investigations are being done. So that we call incidental pituitary tumor. So most of the time, if tumor is very small, tiny, few millimeter tumor, non-functioning tumor. So most of the time this tumor can be observed. We need not to do anything for that. But we need to evaluate, but we need to rule out that tumor is not functioning, and we need to see it's not causing any symptoms in the patient.
Okay.
If patient is asymptomatic, tumor is non-functional, it's very tiny, some millimeter, that can be observed with serial scan.
So then they will certainly have to go for regular checkups.
Yeah,
regular intervals, right?
Yes, yeah. Well, they need to be in follow. But most of the time, these tumors do not grow. Most of the time, it's very tiny tumor. These tumors do not grow. But we need to keep in follow for that.
So, what kind of tests are mostly recommended to these patients?
Mostly to rule out, we do blood investigation, as we discussed, for hormonal evaluation. That what we call that endocrinological evaluation for thyroid, for cortisol, for growth hormone, for prolactin, so on and henceforth. And other investigation is MRI. That MRI can be repeated, and that we can document the growth, whether tumor is same. So that need to be done.
One more thing, I would request you, so kindly help the people out there to understand that since most of the symptoms might be very common or may be very delayed in showing up, so how is that they will understand that this kind of a problem exists and they need to reach out a doctor at the earliest possible?
Yeah, as we discussed, these tumors are non-cancerous, so we need not to afraid of that. We need to understand that these are non-cancerous tumor, and they have very slow growth. They grow period of many years, and that vision problem is very characteristic of these kind of tumors, as we discussed. What we call that bitemporal hemianopia, that side vision loss, as these tumors grows more than 1 centimeter. So if these kind of symptoms are there, and functioning tumor already that we have discussed their symptoms, So if these kind of symptoms are there, so that need to be investigated thoroughly, endocrinologically, hormonally, and ophthalmic evaluation and MRI workup. And that depending on these findings, that these tumors fairly can be treated, that endoscopic surgery is fairly safe, and patient can resume their duties after a couple of days. They get relief of their symptom. Vision loss is vision improvement in vision is very significant. Many a time they report immediately after surgery. If that's not very long, like then that can be, the improvement may take for a couple of months, may take, these tumor can be treated fairly.
Sir, thank you so much for helping us with all this vital informations. I'm sure people out there would learn much from this, and they would reach out to any specific doctor or neurosurgeon who is immediately at their nearest available hospital, so that I'm sure their life will be saved and they will be away from these kind of traumas.
Yes.
So, thank you so much. Thank you, sir.
Thank you.